From Lagos, the nation's commercial capital, this is the News at 10. Live from Channels Television. Reporting tonight, Ijoma Unyato.
Hello and welcome. We do sincerely apologize for that little wait. Tonight, Jigawa state government confirms mysterious death of 92 people within 1 week in Hadeja village, rules out COVID-19 complications in results of investigation. Still in Jigawa, 16 of 45 Almaijiri repatriated from Kano test positive for COVID-19, while results of over 500 others expected. Again, Presidential Task Force on COVID-19 raises concern over disregard for coronavirus guidelines, fears another lockdown may be an option, and Commonwealth Secretary General Patricia Scotland calls for fortification of trade relations among member countries following economic tsunami occasioned by COVID-19. And the World Health Organization warns coronavirus could kill up to 190 people in Africa in its first year, if not contained. Plus, we'll have business, sports, news from Abuja, the FCT, and later on from our studios in London.
On business news tonight, the African Continental Free Trade Deal now set to commence in January next year after its postponement due to COVID-19.
On sports news tonight, the Minister of Youth and Sports Development, Sunday Dare, says COVID-19 provides the sporting industry an opportunity for readjustment.
Just days after the Jigawa state government set out to investigate reports of 100 deaths within a week in Hadeja local government area, the committee probing the mysterious deaths has confirmed that 92 bodies were buried in 1 week. According to the chairman of the committee, Dr. Abdul Wahad Muhammad, only one of the victims has symptoms of COVID-19. And they have given reasons and advised his family members to go into isolation until they get tested.
We went to Hadeja together with WHO and NCDC to find out exactly what was happening. Now, we collected 3 sets of data. We collected data from the hospital over a week period, how many people have died. We found out that there were a total of 44 deaths in the general hospital in the town. There's only 44 deaths that took place over a week period from 28th of April to 5th of May 2020. That was the data from the hospital. Now, we also went to the community, able to gather, to do community survey and find out the total number of deaths that also took place within that same period. And we discovered that there were 46 deaths over that same week period. Now, we now said there's no better evidence of death than the graves where the people were buried. And luckily there are only 2 cemeteries, 2 graveyards in the community. So we went there with the assistance of the traditional councils and the undertakers, and we were able to count the number of graves that were made over that 1 week. And we discovered there were 92 graves over that 1 week period. None of them had history of travel to any place or to any state where there are cases of COVID. And none of them also had history of contact with anybody that was suspected or was confirmed to be having COVID. And incidentally also, 70% of the 46 people have pre-existing illnesses. Either they had diabetes, or they had stroke, or they had dementia, or they had liver disease, or they have chronic kidney diseases. So you can see that they were already above 6 years of age, and they are already also having pre-existing illnesses, chronic illnesses. You understand? So, and also none of them, it's only one of them that had symptoms that were suggestive of COVID.
Meanwhile, 16 out of the 607 Almaijiri evacuated from Kano to Jigawa State have tested positive for COVID-19. This is confirmed by the State Commissioner of Health and the Chairman of the State Task Force on COVID-19, Dr. Abba Zakari. He explains that the positive cases are among the 45 results returned from the testing center and says the other 29 children who tested negative will be allowed to go home.
Health workers on the front line on a mission. Few days ago, this response team from the NCDC embarked on testing some Almaijiri children, mainly repatriated from Kano State, to Jigawa to ascertain their status before sending them to their various homes. Days later, some results of about 600 samples taken are out, and 16 out of the 45 samples have tested positive. The Jigawa State Commissioner for Health, Dr. Abba Zakari, confirms the infections at the NYSC camp in Kiyawa, where almost 700 children are isolated.
About 600 samples were taken, and yesterday we received the result of about 45 of those samples. Unfortunately, out of the 45 results that were released, 16 of them are positive and 29 are negative. Those that are negative, we are going to release them to go back, to their parents, and the 16 will be put in isolation, and they will be given medication until their test results become negative.
But the Commissioner also addressed another issue. As it stands, those children who have tested negative will be sent to their respective families with some palliatives.
Part of the rehabilitation process by His Excellency has ordered that each of the 29 Almaijiris, or each one that is going home, will be given 10,000 naira, and he has also made a pair of clothing for each of them. So we'll use this opportunity to give them the 10,000 naira and then the pair of clothing.
It's important for the various state governments in the northern part of the country to redouble their efforts at this crucial time and end the Almaijiri system to better the lives of the children and protect them from health risks, including the COVID-19 pandemic.
And in the southeast, about 20 persons suspected to be Almaijiri have been apprehended by the Abia State Homeland Security and the COVID-19 task force at the border with the Akwa Ibom State. The suspects were being conveyed to Ikwano local government area in a truck meant for carrying cement. According to the Commissioner, Homeland Security Prince Dan Okoli, the suspected Almaijiri will be sent back to where they came from, while the driver will be charged before the mobile court. The state government warns that it will no longer allow trucks carrying cement into the state, as they are being used to smuggle in persons into communities.
They carry human beings as if they are carrying cement and pass. They usually do that in the night or early hours. These people, when they get to Umuahia now, they will disappear into the society. We don't know their status. They are not supposed to carry one driver and the conductor only. Well, look at the number. So check out if these people are not intercepted and they move in like this on daily basis, the kind of situation we have on our hands in Abia. So that is why we keep people at the borders, to make sure these people are intercepted and the spread of this virus contained.
And over in the nation's capital, the Presidential Task Force on COVID-19 is asking the state government to improve security and welfare at the various isolation and treatment centers across the country. This is against the backdrop of recent protests and cases of patients escaping from some isolation centers because of alleged poor treatment. The task force also frowns on the level of compromise among some security officials in the enforcement of the night curfew, as well as the ban on interstate travel.
The chairman of the Presidential Task Force on COVID-19 leads the day's briefing, expressing the disappointment of government on the various violations of health guidelines for the easing of a lockdown.
It is worrisome, however, to note reports received about isolated cases of compromise by some security operatives. We urge the various commands of the security agencies to enhance their monitoring machinery to ensure that we do not only achieve the objective of stopping the spread of the virus, but also prevent the good name of the services from being tarnished. Reports from various parts of the country indicate high level of non-compliance with the ban on interstate travels. This resulted in a high number of vehicles finding their way across many state borders despite the curfew and border restrictions.
He also appeals to state governments to improve on the security and welfare of patients in isolation centers.
We urge all state governments to continue to pay attention to the welfare of people in isolation and for security agencies to provide adequate security around such facilities to prevent escape.
The Minister of Health gives further update on the evacuation of Nigerians from the United Arab Emirates as well as the Benue Index case.
I join the Secretary to the Government of the Federation in welcoming Nigerians who successfully returned yesterday to Lagos from Dubai. They will be tested, as has already been said, and any person tested positive shall be transferred to a treatment center. As for the patient from Benue, she has agreed to be tested, and then she also, as far as I be informed, gave conditions for being tested that she must be giving all her results, which is okay. What has happened since then, I will find out later this evening when I engage the Chief Medical Director of the hospital.
The Nigeria Center for Disease Control highlights the importance of safety in workplace as businesses resume across the states.
Ensure that your staff are wearing the necessary PPE, the masks, primarily, all the time. We are not going to go around every shop and business to police people, whether they're wearing their masks or not. It's really the responsibility of every organization, every market union that has started, wherever has started working, to make sure that they're doing what they're expected to do. These guidelines offer specific recommendations to businesses on how to exist safely in their own sectors. So we have gone into great detail to ensure that we provide useful advice for almost every type of business to restart safely.
From less than 2,000 confirmed cases as at the end of April this year, Nigeria now has over 3,000 confirmed cases as anxiety mounts over the possibility of government announcing a total lockdown to check the spread of the virus.
In part 2 after the break, is another lockdown declaration looming? That'll be our next focus. In a moment, to John Scott. Welcome back. If you've just joined us, you're watching the news at 10 on Channels Television, coming to you live from Lagos. A reminder of our top stories. Jigawa State Government confirms mysterious death of 92 people within 1 week in Hadeja village, rules out COVID-19 complications in result of investigation. Still in Jigawa, 16 of 45 Almaijiri repatriated from Kano test positive for COVID-19, while results of over 500 others expected. Again, Presidential Task Force on COVID-19 raises concern over disregard for coronavirus guidelines, fears another lockdown may be an option. Commonwealth Secretary General Patricia Scotland calls for fortification of trade relation among member countries following economic tsunami occasioned by COVID-19. And World Health Organization warns coronavirus could kill up to 190,000 people in Africa in its first year, if not contained. Our website, channelcv.com, has more information on our top stories and others. Do subscribe and watch Channels Television's live stream on YouTube and other social media platforms using your mobile device browser, or download the Channels TV app for Android and iOS devices from their respective stores. You can also watch us via your smart TV platforms on Apple TV, Android, Fire, and Roku TV as well. Now let's continue our focus on today's briefing of the Presidential Task Force on COVID-19. And the Minister of Foreign Affairs, Mr. Geoffrey Onyama, is asking Nigerians awaiting evacuation from India to disregard any directive for them to make payments into an individual or corporate account for the exercise. Mr. Onyama's directive is against the backdrop of an alleged claim that someone who works with the Nigeria High Commission in India has opened an account and is directing all who wish to be evacuated to make payments into it. The minister, who was fielding questions at the Presidential Task Force briefing in Abuja, insists that the directive is fraudulent and did not emanate from any of his staff.
The reality is that yes, there is a Mr. Horsfall who works in the Nigerian High Commission in India, but no, he did not publish anything inviting Nigerians to pay money to him or to an account. We directed every embassy and mission to invite Nigerians in those countries to indicate an interest, if they have any, in being evacuated to back home, and informing them that they would have to pay to the airline that is eventually chosen to carry out the evacuation process. So our High Commission in India is in the process of negotiating with a number of airlines, and I would like to also inform those members of the National Assembly who raised the issue that Nigerian airlines are amongst those that have been invited to quote. So they will select an airline, and Nigerians interested will pay directly to the airline. And Mr. Horsfall at no time indicated, at least to the knowledge of his ambassador or any other person, did not invite people to pay to any account.
The Commonwealth Secretary General says the era of coronavirus pandemic is a testing time for members of the Commonwealth, but she believes that the things that join member countries are more important. Ms. Patricia Scotland speaks about the need to fortify the trade relations following an economic tsunami, which she says is coming due to the economic impact of COVID-19. In a video conference with our correspondent Millicent Walker, Ms. Scotland spoke about exploiting the Commonwealth advantage and the benefits of the Africa Free Trade Area.
Things that join us are really important. We share the same language, the same common law, similar structures in terms of governance, and that gives us a 19% advantage when we trade with one another. Our systems reflect one another, and there's a great deal of compatibility. So over the years, we've identified this Commonwealth advantage for doing business, and we've been able to start now to positively exploit it. Up until last year, we identified that the amount of trade between our Commonwealth family of 54 was $700 billion. We anticipate that it may be possible to increase that to $2 trillion by 2030. And this opportunity is made even more sharp by two things. The first is we have the World Trade Organization's Trade Facilitation Agreement. And because our systems are so similar, and because we've got this 19% advantage, and we settle our disputes 20% more quickly, we can work together to make sure the boulders that are getting in the way for our trade can be moved out, and so that we can accelerate the amount of trade between us. So that's one. But the second, which is even more important, particularly for Africa, is the creation of the African Free Trade Area. And that, you know, was agreed, and it was supposed to come in July, and we're hoping that it still will do. But Nigeria has done a great deal on that, but we know so has the other AU countries, and that Ghana is going to have the Secretariat. So we here in the Commonwealth not only helped to facilitate that in the AU by giving our expertise, not experts, but we have continued to commit to the African Union and to the African Free Trade Area to try and make sure that we can ease the trade between us. And we're going to need that trade.
The Presidential Task Force on COVID-19 warns that the government may be left with no other option than to enforce a total lockdown if citizens continue to violate the health safety advisories issued before the relaxation of the lockdown. At the daily news briefing of the task force in Abuja, the national coordinator, Sani Aliyu, expressed serious concern over the high level of non-compliance with the guidelines on social distancing, the use of face masks, and the ban on interstate travel.
I would like to continue to express the concern of the PTF with regards to the persistent violation of the guidelines that were released at the beginning of last week. We had a lockdown of Lagos, Ogun, and FCT for 5 weeks in order to slow down the epidemic and enable us to prepare well. The gains of this lockdown could be destroyed if people continue to violate the guidelines that we have set out. Just to remind the public about some aspects of the guideline, as mentioned earlier on by the chair, all flights are banned for another 4 weeks except for those providing essential services. Schools remain closed. Supermarkets are allowed to open between the hours of 8 a.m. and 3 p.m. Banks between the hours of 8 a.m. and 2 p.m. But I must emphasize the need for physical distancing and avoiding mass gatherings beyond 20 persons. The mandatory overnight nationwide curfew remains between the hours of 8 p.m. and 6 a.m. If we continue to have violations of the guideline, then we'll be pushed to review some of these measures.
We'll stay in Abuja, but here's my colleague, Ibrahim Adra. Ibrahim?
Many thanks, Ijoma. Governor Darius Ishaku of Taraba State is worried that the unavailability of testing equipment for COVID-19 has made it difficult for the state to easily detect those infected. According to him, the delay time between testing and confirmation is rather too long, especially as it concerns sending samples to faraway Abuja for confirmation. Governor Ishaku says he has indicated interest for mobile test equipment during a teleconference meeting with the Northern Governors Forum. The governor was speaking when the management of the National Youth Service Corps in the state donated personal protective equipment produced by Corps members to help the fight against COVID-19.
One of the ways we can curb it or reduce it is if we have testing equipment. For now, we don't have in Jalingo. We understand after our teleconference meeting of Saturday with our colleague governors in northern Nigeria that there is a mobile testing equipment, of which we have indicated that we are interested, and we are hoping that very soon we will have it here in Jalingo. If we have it here in Jalingo, the case we had before, 130 people coming in, we could easily stop them, screen them that day, the following day. We know those who are negative, we ask them to come in. Now we know those who are positive, we ask them to go to the clinic, and then we start with the procedure of treatment.
And from the northeast to the northwest, where Kano State has announced that 16 more COVID-19 patients have been discharged after recovering from the infection. The coordinator of the State Committee on Rapid Response, Dr. Tijani Hussaini, confirmed this to Channels Television. He says as of today, the total number of discharged patients stands at 22. Meanwhile, 5 other patients lost the battle to COVID-19, raising the death toll in the state to 13. Kano reported 30 new cases of coronavirus on Wednesday. A former commissioner in the state who was recently sacked by the state government for allegedly celebrating the death of former chief of staff to the president has tested positive for COVID-19. Muaz Magaji posted on his Facebook page that he had been confirmed positive after the result was released by the NCDC and has been moved to an isolation facility. Elsewhere, Governor Nyesom Wike of Rivers State has commended residents of the state for complying with the lockdown directive to check the spread of coronavirus. The governor, who spoke after monitoring the exercise, noted that the level of compliance is up to 95%. He also accused the Deputy Commissioner of Police Rivers State Command of moves to sabotage the lockdown by issuing illegal letters to companies. The governor insists that approval issued by the police or any other authorities outside the office of the Rivers State Governor are illegal. He adds that all those who were arrested violating the lockdown will be prosecuted by the state government. Positive cases of the coronavirus, that is COVID-19, have been reported in Niger State. The Commissioner for Health, Dr. Mohammed Makusidi, announced this while giving an update and situational report on the virus in the state. He says one of the new cases is the husband of the only woman at the isolation center from Suleja and a returnee from Kano. According to Dr. Makusidi, the second new case is a man who is already at the quarantine center from Zumba and also a returnee from Kano. It now brings the total number of confirmed cases in the state to 8. The commissioner, however, explains that the Limawa Index case is now negative and awaiting second negative test confirmation before being declared cured. And when the news at 10 returns, we will bring you more update on COVID-19, plus African Continental Free Trade Deal now set to commence in January next year after its postponement due to COVID-19. At some business news, join us again. It's the news at 10 on Channels Television. A former president of the Association of Medical Lab Scientists of Nigeria, Dr. Godswill Okara, says Nigeria still has a very low COVID-19 testing capacity, which means the country does not really know how fast the disease is spreading and cannot put adequate measures in place to combat it. The Nigeria Center for Disease Control has been criticized for having one of the slowest testing methods in the world. Dr. Okara spoke with our correspondent Kayla Megwa on some of the benefits of Nigeria's testing method.
For the enforcement.
The Director General of the NCDC says Nigeria has a testing capacity of 50,000 people daily. The key word is capacity, because according to reports, the actual number of people being tested daily is very low. It is particularly hard on the Nigerian government, as they are being compared with countries like South Africa, Ghana and Senegal, who boast of mass testing and $1 test kits. To find out what can be done about Nigeria's testing method, we speak to Dr. Godswill Okara, a medical laboratory scientist and the former president of the National Association of Medical Laboratory Scientists of Nigeria.
Yes, South Africa is doing tremendously well in the sense that they have mobile PCR testing facilities. Ghana is doing what we call pooling system. If you have 10 samples from 10 different individuals, you take a little bit of each of the 10 from the 10 individuals and pool it together. You are testing only one. If it turns out negative, you take it that all the 10 are negative. If it turns out positive, you now go again and test individually all the 10 to discover which of the 10 is positive that gave the positive result. There is a drawback in that. That method is prone to what we call false negative result. Our own testing system is better, even though it could be slower, but when you upscale the number of testing sites, in the long run, it will be far better. The latest version of this system is about $79,000. So if you adopt that with the automated DNA extraction system, that's about another $27,000. It is not beyond a state government. Every state government can set up a molecular testing center.
If those testing figures remain low, will there be a need for another lockdown for better containment of the pandemic? Kayla Nagwa, Channels Television News.
Many thanks, Kayla. The Ebonyi state government is set to activate 64 development centers across the state to curb the spread of the coronavirus disease. According to the state governor, Dave Umahi, the activation of the development centers in all 13 local government areas in the state will distill people who smuggled themselves into the state through the local communities. Governor Dave Umahi offered this explanation during a State Security Council meeting at the government house at Abakaliki, the state capital. He also asked traditional rulers, councillors and other stakeholders to identify those who smuggle themselves into the local communities and bring them to development centers for health screening and possibly quarantine.
In that center, we arrange to feed them for 14 days. We encourage people not to mix. They should be distancing within that location. And if you have served 14 days, where we observe you and they screen you, then we give you certificate of participation and then you will go home. Presently, we have only 5 people that are being treated. We have over 700 that we are holding at the isolation center. And we will not leave them until after 14 days when we test them because they're coming from Lagos, from Edo State, from Port Harcourt.
In Nasarawa State, 46 COVID-19 tests out of the 50 conducted have come out negative, with the remaining tests being awaited. Governor Abdullahi Sule revealed this at the State Executive Council meeting at the Government House in Lafayette today. The governor added that the samples of state lawmakers are not part of the 46. The rest. Our correspondent Halima Gayam brings us more.
With over 10 confirmed cases of the coronavirus in Nasarawa State and 1 fatality, the state government is reinforcing measures to contain further spread of the virus. Among the measures taken is the lockdown of Nasarawa local government area where the deceased lawmaker hails from, which is the first fatality, to enable contact tracing and sampling. The House of Assembly has also been shut for 1 week, and it has also been completely decontaminated. All the House of Assembly members have gone into isolation and their result is being awaited. The use of face masks has also been made compulsory. Thousands of Almaijiris have been repatriated from the state to other states, and those who have come in from other states have also been isolated. To begin from tomorrow, over 2,000 Almaijiris from the state would be transported to Kano and Katsina states. Other previous restrictions to include curfew between 8 p.m. to 6 a.m., ban on social gatherings, ban on interstate traveling, enforcement of social distancing order, intensified patrols and surveillance by security personnel to ensure compliance and to maintain status quo. Earlier today, the governor convened an executive council meeting to enable office holders brainstorm on how to contribute financially to the fight against COVID-19 in the state.
I want to announce my own personal contribution of 10 million naira to the COVID-19.
And after hours of deliberations, office holders agreed unanimously to donate 50% of their salaries to commence from June for 3 months to the fight against COVID-19 in the state. Results for 46 tests have come out and they are all negative as announced by the governor before the EXCO meeting, and other results are being awaited.
Our correspondent Halima Gayam from Lafayette. That's all from this end as we rejoin Ijoma in our Lagos studio.
Thanks a lot, Ibrahim. 10 persons associated with the Lagos State House and Marina have tested positive for COVID-19. The Commissioner for Health in a tweet today announced that the Governor of Lagos State, Babajide Sanwo-Olu, and his wife have both tested negative consistently for the virus following 3 tests conducted on them recently. Professor Abayomi called on all to continue to use face masks and to adhere to other precautionary measures in fighting the pandemic. Meanwhile, the Lagos State government has announced the discharge of 48 COVID-19 patients after they all tested negative. The State Ministry of Health confirms in a tweet that the patients consist of 32 males and 16 females. The Regent School in Abuja has donated all its school beds to one of the FCT's isolation and treatment centers for COVID-19. During a tour of the facility, the Vice Principal of the school, Mr. Olusegun Akinola, explained that the school is donating 180 beds to the center. He says the effort is part of the institution's corporate social responsibility.
This State Dome is one of the facilities being set up to serve as an isolation and treatment center in Abuja. What you see here is a collaborative effort of the private sector, including a foremost Abuja-based private school, the Regent School. The Vice Principal of the school, Mr. Olusegun Akinola, takes journalists on a tour of the facility, explaining that the school is contributing over 180 beds and mattresses to the center, which has an over 300 bed capacity.
When we were told that there was going to be a lockdown, and government was calling on different establishments to offer support in whatever way they could offer the support, we were told that there was a need for beds at this center that we're going to start, and our school, the board of the school, the Regent Secondary School, donated 180 beds, also mattresses, and we also covered the mattresses. And we were told that it's almost time for them, I think, to open this place. And so it's not always about the cost; it's always about a need and rallying around. We have our board is very, very supportive, always ready, to give back. We also have, whenever we call upon our community in the school, everybody's always willing to give back. I'll give an example. Recently, our students raised a lot of money to drill boreholes in local communities in Abuja, and this was done by them.
The school prides itself as being at the forefront of those rising to the challenges associated with the COVID-19 pandemic.
Regent School in particular, I did mention, Regent School, they provided a good number of the beds that you can see here. We appreciate the Regent School.
The Regent School Abuja is an international school with nursery, primary, secondary and A-level college. The school has been in existence for 20 years and has consistently produced the best international general certificate of secondary education results in Nigeria.
Leading food manufacturing and marketing company Nestle Nigeria is donating 450 million naira worth of food and beverages to support the COVID-19 response efforts in Nigeria. The company is also donating 250 million naira for the procurement of medical supplies and personnel protection equipment, I beg your pardon. These are expected to reach more than 600,000 vulnerable people most affected by the pandemic.
The COVID-19 pandemic is an unfolding global tragedy with far-reaching effects, particularly on the poor and vulnerable members of a society. While the federal government is unfolding action plans to reach this critical group, Nestle Nigeria is rising up to the challenge of supporting COVID-19 response efforts in the country. Nestle Nigeria is contributing over 700 million naira, which includes nutritious food and beverage products worth 450 million naira to reach more than 600,000 vulnerable people mostly impacted by the COVID-19 pandemic. The organization presents these food items and beverages to the Presidential Task Force on COVID-19 in Abuja.
We are donating food and beverage worth 450 million to support the food banks in Lagos, Ogun, Ekiti, Rivers, Kaduna, Kano, Enugu and Ondo State, as well as Abaji community within the FCT. So in addition, Nestle Nigeria has donated 250 million for the procurement of medical supplies and personal protective equipment, PPE.
We will be publishing whatever we get online and also in publicly in newspapers, etc., so that the public would know what we're doing with this.
It's time to take delivery of the food items and beverages which are loaded in these trucks packed outside the office of the Secretary to the Government of the Federation in Abuja. Nestle Nigeria says it is committed to cushioning the effects of COVID-19 on Nigerians, and hopefully these items donated will bring succor to many who are in dire need of financial or material assistance.
Let's take a look at some business news now. Here's Teniola Shobowale.
Thanks, Ijoma. Welcome to Business News. The confirmed new takeoff date for implementation of the African Continental Free Trade Agreement is now January the 1st, 2021. That's according to the Acting Chief Trade Negotiator and Director General of the Nigerian Office for Trade Negotiations, Mr. Victor Liman. In a statement today, Mr. Liman says the new date will allow member countries to schedule specific commitments on trade and services, give members space to finalize outstanding issues on the rules of origin, and allow schedule of tariff and goods offer. The implementation of the Africa Trade Deal, which was earlier scheduled to commence on July the 1st, 2020, is said to have a total of $1.2 billion in market size, $2.3 trillion GDP, and $4 trillion investment within the continent. Vice President Yemi Osinbajo has met with the Presidential Power Sector Reform Working Group, which he serves as chairman. The group, which includes Kaduna Governor as the head of the committee, the Minister of Finance, Budget and National Planning, Mrs. Zainab Ahmed, the Central Bank Governor, Mr. Godwin Emefiele, and others, is expected to oversee the design and implementation of a well-coordinated roadmap for the sector. The Power Sector Reform Group, which was created by President Muhammadu Buhari about 2 months ago, is expected to coordinate the ad hoc committee reviewing the ownership of the electricity distribution companies by November this year and significantly improve output within sector. Well, despite a nearly 2% drop recorded by bank stocks, the local equities market maintains positive posture for the 9th consecutive session at the close of today's trading. Chimeze Obi Iwawogu tells us more.
Thank you and welcome to Stock Market Report. Profit taking, that's the best description of today's transaction. Impatient investors couldn't wait to cash out. Look at the banking sector, which was investors' toast on Wednesday after GT Bank gained about 10% take a beating, making that sector the only loser on the sectoral chart, down nearly 2%. That tells you that market is just riding on a speculative short-term transactions. Generally, we saw the bulls and the bears struggle for supremacy on the consumer goods, industrial, and the banking sectors. However, the bulls came out the winner. Thanks to Dangote Cement, Bua Cement, Nestle, and Nigerian breweries, these four upheld the market today. And so, when the closing gong sounded, the all-share index landed moderately positive by 0.87%. Transaction activity remains impressive, a little over 5 billion naira raked in today. With current volatility, traders say it won't be a surprise if the market closes negative on Friday. Let's keep our fingers crossed. And that was the Stock Market Report. I'm Chimeze Obi Iwago.
Renewed optimism for the reopening of the U.S. economy lifted investors' sentiment on Wall Street and markets across Europe at the close of today's trading session. Let's take a look at the global markets closing figures for the day. And that's Business News tonight. It's back to you, Ijoma.
Thanks, Teniola. Still ahead on the news at 10, World Health Organization warns coronavirus could kill up to 190,000 people in Africa in its first year, if not contained. Plus more stories from our London studio in Around the World in 5. Please stay with us. Welcome back. The World Health Organization is warning that the coronavirus could kill between 83,000 and 190,000 people in Africa in its first year, if not contained. Here's Simon Pusey with Around the World in 5.
Good evening and welcome to the Channel Studios in London with your international news around the world in 5.
It's going to be a very big year.
US President Donald Trump has described the coronavirus pandemic as the worst attack ever on the United States, claiming China is responsible. The US currently has 1.2 million confirmed cases of COVID-19 and more than 73,000 deaths.
From an economic standpoint, I think next year is going to be a very big year. There's tremendous demand. You see it with the stock market, where the stock market's at 24,000 and we went through the worst attack we've ever had on our country. This is really the worst attack we've ever had. This is worse than Pearl Harbor. This is worse than the World Trade Center. There's never been an attack like this. And it should have never happened. Could have been stopped at the source. Could have been stopped in China. It should have been stopped right at the source. And it wasn't.
Racial tensions are rising in the US state of Georgia after a young African-American man was shot dead while jogging. Ahmed Arbery was jogging when he was confronted by two white men, with one of them shooting him twice before claiming he thought he was a burglar. Former United States Vice President Joe Biden has joined other politicians calling for a just and transparent investigation into the fatal shooting. British Prime Minister Boris Johnson has revealed he will disclose the UK government's route map out of lockdown in a televised statement on Sunday. The idea will be to relax some restrictions starting on Monday. However, he admitted being worried about triggering a second deadly spike in cases if the restrictions are eased too quickly.
We'll want, if we possibly can, to get going with some of these measures on Monday. I think it would be a good thing, Mr. Speaker, if people had an idea of what's coming the following day. That's why I think Sunday, the weekend, is the best time to do it. But of course, the House will be fully informed and the House will have the full opportunity to debate. It would be an economic disaster for this country if we were to pursue a relaxation of these measures now in such a way as to trigger a second spike.
The Chinese government has reported no new local confirmed cases of COVID-19 for 4 days in a row. The government also reported no new deaths due to the coronavirus for 22 days. China has reported almost 83,000 cases with more than 4,600 deaths. In Italy, protests from frustrated business owners are taking place all over the country after the government eased up some of its strict lockdown restrictions this week. In Milan, restaurant owners set up empty chairs to demand financial help from the government, fearing they will not make enough money if they reopen due to the low numbers of customers. A chemical gas leak at an industrial plant in southern India has killed at least 9 people. Emergency services rushed more than 300 people to hospital. The leak contaminated an area of 3 kilometers in radius, and hundreds of people were evacuated by police. In Israel, Prime Minister Benjamin Netanyahu's indictment on corruption charges has not disqualified him from forming a government. That's according to the latest pronouncement of Israel's High Court. Netanyahu was indicted in January on charges of bribery, fraud and a breach of trust. He denies any wrongdoing in all 3 cases. In South Africa, school children are facing hunger after school closures halted the feeding programme, providing meals to 9 million children from low-income households. A number of education and children rights groups are calling on President Ramaphosa to immediately restart the scheme or replace it with viable alternatives.
We have kids here at school. We have 2 kids waiting in the line, and when we started, they washed their hands and they just wanted to fight.
In Chile, taxi drivers are protesting in the capital Santiago to demand financial assistance from the government to cope with the reduced income due to the virus lockdown. The taxi drivers demanded to be included in the economic aid package the government announced, from which they are currently excluded. And finally, residents in an apartment building in northern Italy have had an unexpected visitor, a wild brown bear who tried to get into a second-floor flat. The bear was filmed trying to climb the balcony before changing its mind and running away. Despite the scare for residents, there were no injuries reported, and forest rangers were called to investigate. And that's your international news around the world in 5. Now back to the Channel studios in Lagos.
Welcome to Sports News. The Minister of Youth and Sports Development, Sunday Dare, has said the sporting sector must map out ways to reopen with minimal exposure to COVID-19. Mr. Dare said this today in a series of tweets on his official handle that aside from keeping the citizens healthy, finding out the safest ways to restart sporting activities is crucial. That's Sports News. Ijoma, back to you.
Thanks a lot, Olumide. And the main news again. The Jigawa state government today confirmed the mysterious death of 92 people within 1 week in Hadeja village. The state government ruled out COVID-19 complications in the results of the investigation. That's the news at 10 tonight. Thanks a lot for staying with us. I'm Ijoma Unyato. Stay safe and good night.